Sorry, I don't have my video on today because I'm at home sick, so
Oh,
yeah.
well, thanks for
But I
doing
can see
this.
your screen if you put anything on the screen.
Okay, perfect. Yeah, I'll probably just kind of bounce some questions off here. So generally, what type of like patient demographics do you kind of serve? Like, are there specific like age groups or like special like conditions that you kind of work with?
Yeah, all demographics like age and like how they present. In terms of upper limb, there's like a much smaller population of upper limb amputees. Um, so typically upper limb um would be like congenital, so maybe they were born with a limb difference,
Okay,
or um, traumatic injuries. So oftentimes that's like as a result of a workplace injury. So
okay,
that ranges from like missing fingers, parts of hands, all the way up to like, the shoulder level.
okay.
So um, yeah, I would say it's kind of traumatic
Yeah.
or you're born with that difference. So
Okay,
um,
cool. Um, and then if you have like patients that are kind of like skeptical or maybe like reluctant to get a prosthetic, what would you say is kind of like the largest factor um in that?
I mean, usually when they're coming to see us, they typically do want to use a prosthesis. They've like already explored options
Okay.
on the internet, and sometimes they're coming with like specific interests. I guess
Okay.
sometimes they might come to us and yeah, they've seen something online, and sometimes that product's like not available in Canada, or maybe it's not appropriate for the use, like the activities they want to use it for.
Okay.
And commonly people are coming for quite specific um, types of devices. They want to, use it to like help them ride their bike or play hockey.
Okay.
Um, there's a lot of like activity specific prosthetics in upper limb. So
Okay. That
yeah,
makes sense. Yeah, for
yeah.
sure. Okay, cool. And then you kind of covered like the different types of prosthetics because you said like yeah, some like fingers, some like full hand. Um,
Yeah.
what would you say is like the most common one that you work on?
Oh gosh, right now it's a lot of like missing fingers, but that's also
Okay.
like super interesting that it's just become more prevalent that I've been seeing that the past couple of years. But um, we're talking about above the hand, I would say the transradial, so below elbow level of amputation is probably the most
Yeah.
common fit patient. Yeah.
Okay. Yeah, no, that makes sense. And yeah, even some of the articles that we kind of researched beforehand, it was like finger amputations were like 80% of the upper limb. And then
Yeah.
like the transhumeral and transradial were only like a little bit.
Yeah.
Um, okay. Um, do, do, do. I'm gonna go. What would you say are like the main kind of factors or parts of like the prosthetic that affect the like comfortability and like usability of it? Like I know that probably it's gonna be the attachment site, but what would you say like maybe specifically users have trouble with when fitting a prosthetic?
Um, um, like comfort is pretty important. If it's not comfortable, they're not going to use it. So, you have
Yeah,
to make
yeah.
sure everything's really smooth on the inside, fits well. Um, Sometimes that
Like
means having a cushion,
okay.
liner, some barrier on their skin, a sock sometimes,
Okay.
and then making sure that if they have any pressure areas from the prosthesis, that they come in and have that adjusted right away so
Okay.
that we can accommodate for those pressure spots.
That's right. Okay. Okay, that makes sense. And would you say that
Yeah.
like weight bears a factor in some of that, or is it more just kind of like the
Oh
spots
yeah.
where, yeah, okay.
Yeah, you want to keep it as light as possible just because um you really do notice the weight of prosthetics, especially if they don't have like a super great fit, like intimate fit to
Yeah.
their limb. Um, and in upper limb prosthetics, you definitely want to try and keep the weight as low as possible, just so that they're more inclined to use it,
Okay.
and so that it helps them. It doesn't, yeah,
That makes
hinder what they're
sense.
trying to use it for.
Yeah. Awesome. And then at your workplace, do you work more with like passive prosthetics or like electronic or like body controlled?
All of them. I think
Okay.
a lot of people who like passive is probably the most popular, I guess, and just because there's like passive, so like ones that look like an arm, so they have a hand attached and it's passive prosthetic arm, or
Yeah.
passive could also be functional in the sense that it's used for a specific activity. So bike riding again is like a big one, um, or like working out of the gym. People have different attachments for that.
Okay.
And then myoelectric is also probably the next popular. But at the same time, people have often tried the body powered devices before they got a myoelectric prosthesis. So yeah, I feel like myoelectric is definitely what's out on the internet. So people are always
Yeah.
curious about it.
Yeah, that makes sense for sure.
Yeah.
Okay, cool. So as far as like for pain and patients, like, we kind of when we researched, we saw that there's a lot of like residual limb pain, but also phantom limb pain seems to be a major impact for patients, kind of like like several months after their amputation versus like the residual limb pain is like freshly after amputation. Um,
Mhm.
how do you kind of deal with that phantom limb pain and or how does it affect your patients for the prosthetics?
Yeah, so phantom pain is something that not everyone will experience, but there's different therapies they can do. So they can do like kind of extensive mirror therapy, desensitization. Sometimes wearing a prosthesis can actually help with the phantom pain because it, tells the brain when there's a hand attached to it. It tells their
Yeah.
brain attached to them. Sorry, um, tells their brain like there's a hand there. So sometimes it's like a little trick is to try and use a prosthesis can kind of help with the phantom pain.
Yeah.
But it can also be really difficult at the same time because it can be really distracting. It can affect their sleep. It can affect their interest in wearing a prosthesis. So it can also be the opposite where they don't want to wear a prosthetic device because it actually like can make things worse for them.
Yeah.
Um, so usually it's often or like sometimes they take medicine um for phantom limb pain to see if they can kind of calm it down. Um, so yeah, I feel like in terms of affecting prosthetic wear or use, it's really patient specific.
Okay, that makes sense for sure.
Hmm.
Um, okay, so kind of in our studies as well, we've seen that it seems like a lot more, like a higher percentage of lower limb patients are get the ones getting prosthetics as opposed to the upper limb patients. Does that kind of reflect in your day-to-day work as well?
Sorry, was that question? Do we see more lower limb than upper limb?
Yeah, yeah.
Okay,
Sorry.
got distracted. Yes, um, definitely way more lower limb
Okay. And would
than upper
and
limb.
would you
Like,
say from that it's like the lower limb patients are more like satisfied with the prosthetic, or they just like that's gonna result in way more like what's the like more benefit in their life than the upper limb patients would get from benefit from a prosthetic?
yeah, they're just already like upper limb is only like 20% of the people that we see, I would say. So
Mhm.
it's a pretty small population. And then, yeah, how helpful is the device going to be for them? Obviously, for lower limb amputees, they'll like can help them walk or transfer, stand, balance, all that kind of stuff. So lower limb amputees are definitely more inclined to make that device fit
Yeah.
and like follow up and make sure that it's working for them. Upper limb, again, depending on the device you're fitting, you might fit uh, an arm and they might not come back for a couple of years because either it works really well and it works for what they need it to, or uh, they take it home, try it, and put it in the closet after realizing it doesn't really do anything for them, which we
Okay.
don't really see in the lower limb.
Yeah. Yeah, for sure. Um, okay. Okay, in the patients that you do have to see like multiple times for either like fitting issues or just readjusting, again, would you kind of say that that's more like lower limb, upper limb, kind of an even split?
Lower limb
Lower
require
limb?
more adjustments. Yeah.
Yeah. Okay, for sure. Let's see. And then, would you be able to just kind of like run us through maybe a life cycle of a prosthetic, even if like you're just kind of choosing like a recent patient that you had, how the fitting went, how they used it, if they like upgraded, all of that stuff.
Yeah. Just trying to think who I should use as an example.
Yeah, no
Um,
worries. It's kind of a long
yeah, I
question.
have yeah, I have a younger girl, she's 16, who, growing up, she had passive arms, like the ones with a hand attached that just looked like an arm. And then she also had activity specific, so we made her an arm that like helped her paint, so it held the palette so that she could use the brush in her dominant hand, but had to hold the palette with her prosthesis. Um, and then she had never had a mile, but she came back wanting a mile after, many years of wearing a passive arm. She decided that now that she was starting a part-time job, that maybe this might help her at her job, which was working in like a fast food restaurant. And she got this myoelectric arm that like worked pretty well. It's a pretty big upgrade from, the passive arm, but um, there's a big learning curve and acceptance, and the weight of the myoelectric device is pretty significant compared to a passive arm. So she she tried to wear it a few times, but found, the weight kind of bothersome. And then she just kind of couldn't integrate it into her life enough to use it to its full capacity. There wasn't any like occupational therapy involved in training her or anything. It was she was out of town, and we fit the device and explain how it all works and um, some recommendations. But she, I think, ultimately, I don't think she wears it as much as she was hoping she would, or the family was hoping she would wear it. Um, so I guess that's kind of the reality of some of these patients, is that they want all this technology, but they find it hard to kind of integrate into their life, and they don't know until they have it. So it's kind of those things that if you don't have it, then you don't really know what it can or can't do for you. So yeah, I feel like that's one of those cases that I saw in the like recently, that just kind of it's not really that uncommon to have that happen.
Yeah, that makes a lot of sense. And I feel like,
Mm,
yeah, maybe we can focus kind of more on like the myoelectric side of it and perhaps the weight, because yeah, those ones would definitely that makes sense for them to be quite a bit heavier than the passive prosthetics.
hmm.
Okay. I think that's all we have. Some of the questions that we had were kind of you already answered them. So I think
Okay.
that yeah. I think that's all we have. Sonia, are you good? I think
Yeah, I think I'm good with that.
Okay. Okay, cool. And then we'll just do our summary after. Okay. Awesome. Thanks so much again, Candace, for meeting with us. We really
Yeah,
appreciate it.
you're
Um,
welcome.
and yeah, have a good rest of your day.
Thank you.
Okay,
You
bye-bye.
too. Bye.
Okay.